Best way to study for phlebotomy exam. Question 1. What is the primary clinical consequence of warming an infant's heel prior to a dermal puncture? Option A. It decreases the pain perception of the infant. Option B. It increases localized arterial blood flow up to 7-fold. Option C. It sterilizes the deeper layers of the epidermis. Option D. It prevents the formation of an unneeded hematoma. The correct answer is option B. It increases localized arterial blood flow up to 7-fold. Warming an infant's heel increases local blood flow and improves capillary specimen collection. Better perfusion can reduce squeezing, which helps avoid tissue fluid contamination. Warming does not sterilize tissue or eliminate the need for proper puncture depth. Question 2. When collecting a blood alcohol level for legal purposes, what antiseptic should be used to cleanse the site? Option A. 70% isopropyl alcohol. Option B. Tincture of iodine. Option C. Chlorhexidine gluconate or soap and water. Option D. Hydrogen peroxide. The correct answer is option C. Chlorhexidine gluconate or soap and water. Alcohol-based skin cleansers are avoided for legal blood alcohol collections because they can raise questions about contamination. Chlorhexidine, povidone iodine, or soap and water are acceptable non-alcohol alternatives depending on policy. Routine alcohol prep pads are appropriate for many venipunctures but not for forensic alcohol testing. Question 3. Why is it essential to allow the 70% isopropyl alcohol to dry completely on the skin before puncturing? Option A. To prevent the alcohol from evaporating too fast. Option B. To avoid hemolysis of the specimen and a stinging sensation for the patient. Option C. To ensure the vein does not roll during insertion. Option D. To maximize the chemical interaction with the tube additive. The correct answer is option B. To avoid hemolysis of the specimen and a stinging sensation for the patient. Alcohol must dry completely so it can disinfect effectively and avoid being carried into the puncture site. Wet alcohol can sting and may contribute to hemolysis or specimen contamination. Blowing on or fanning the site can recontaminate the area and should be avoided. Question 4. What does a trough level measure in therapeutic drug monitoring, TDM? Option A. The highest concentration of the drug in the patient's system. Option B. The lowest concentration of the drug, measured right before the next dose. Option C. The average concentration of the drug over a 24-hour window. Option D. The amount of drug excreted through the kidneys. The correct answer is option B. The lowest concentration of the drug, measured right before the next dose. A trough level measures the lowest drug concentration, usually just before the next scheduled dose. Timing is critical because the result guides dosing safety and therapeutic effectiveness. Peak levels measure the highest concentration after dosing and answer a different clinical question. Question 5. Which organization regulates safety conditions in the workplace, including exposure to blood-borne pathogens? Option A. CDC. Option B. FDA. Option C. OSHA. Option D. CLSI. The correct answer is option C. OSHA. OSHA sets and enforces workplace safety requirements, including rules for blood-borne pathogen exposure. These standards address training, protective equipment, sharp safety, and exposure control plans. CDC and CLSI provide guidance, but OSHA is the regulatory enforcement agency for workplace safety. Question 6. What is the clinical term for blood that has escaped from a vessel into the surrounding tissue layers? Option A. Petechiae. Option B. Hematoma. Option C. Thrombus. Option D. Hemostasis. The correct answer is option B. Hematoma. A hematoma is blood that has leaked from a vessel into surrounding tissue. It may appear as swelling, bruising, or tenderness at the puncture site. Petechiae are pinpoint hemorrhages, while a thrombus is a clot inside a vessel. Question 7. What should a phlebotomist do when a multisample vacuum tube fails to fill with blood during a draw? Option A. Gently advance or pull back the needle slightly to ensure it is in the lumen. Option B. Remove the needle completely and start over on the other arm. Option C. Leave the tube in place for 3 minutes to allow the vacuum to recover. Option D, push the needle deeper at a 90-degree angle. The correct answer is option A, gently advance or pull back the needle slightly to ensure it is in the lumen. A vacuum tube that fails to fill may indicate the needle bevel is against the vein wall or not fully in the lumen. A small adjustment forward or backward can restore flow without unnecessary reinsertion. Pushing deeply or waiting for the vacuum to recover can injure tissue and waste time. Question 8. What type of vessel links the arterial system directly to the capillary network paths? Option A, arteriole. Option B, venule. Option C, vena cava. Option D, deep vein. The correct answer is option A, arteriole. Arterioles connect arteries to capillary beds and regulate blood flow into tissues. Their muscular walls can constrict or dilate to control local perfusion. Venules drain capillaries, and lymph ducts carry lymph rather than arterial blood. Question 9. What is the main clinical outcome of inadvertent arterial puncture during a venipuncture attempt? Option A, rapid hematoma formation and bright red pulsing blood. Option B, falsely decreased systemic blood pressure. Option C, accelerated hemolysis within the vacuum collection tube. Option D, immediate collapse of the surrounding capillary beds. The correct answer is option A, rapid hematoma formation and bright red pulsing blood. Accidental arterial puncture often produces bright red, pulsating blood and can cause rapid hematoma formation. The needle should be removed and firm pressure applied because arterial pressure is higher than venous pressure. Treating it like a routine venous draw increases bleeding risk. Question 10. What should a phlebotomist do if they notice that the expiration date on a vacuum collection tube has passed? Option A, use the tube anyway if it is the only one available on the tray. Option B, discard the expired tube and select a current, unexpired tube from inventory. Option C, assume the additive inside is still functional for another 6 months. Option D, write the current date over the expiration date on the label. The correct answer is option B. Discard the expired tube and select a current, unexpired tube from inventory. Expired vacuum tubes may have reduced vacuum, degraded additives, or compromised sterility. They should be discarded and replaced with unexpired tubes from inventory. Using an expired tube can cause short draws, clotting, contamination, or inaccurate results. Question 11. What type of legal charge can be filed if a phlebotomist discloses a patient's private medical details to a neighbor? Option A, assault. Option B, battery. Option C, invasion of privacy or breach of confidentiality. Option D, negligence. The correct answer is option C, invasion of privacy or breach of confidentiality. Sharing a patient's private medical details with a neighbor is a breach of confidentiality and invasion of privacy. Health information may be disclosed only for authorized treatment, payment, operations, or with proper permission. Assault and battery involve threats or touching rather than privacy violations. Question 12. Which of the following tubes contains no additives or gel barriers and is often used as a discard tube or for specialized serum testing? Option A, clear or plain red glass top. Option B, light blue top. Option C, lavender top. Option D, light green top. The correct answer is option A, clear or plain red glass top. Clear or plain red glass tubes contain no additive or gel and may be used as discard tubes or for selected serum testing. They are useful when additive carryover must be avoided. Colored additive tubes contain substances that can interfere with tests not designed for them. Question 13. Which of the following tubes should be collected first when performing a venipuncture draw using a multisample needle? Option A, light blue top, sodium citrate. Option B, blood culture bottles or yellow SPS tube. Option C, red top, serum. Option D, green top, heparin. The correct answer is option B, blood culture bottles or yellow SPS tube. Blood culture bottles or yellow SPS tubes are collected first in a multisample draw. This protects the culture from additive carryover and supports sterile organism recovery. Coagulation and other additive tubes follow in the established order of draw. Question 14. What type of safety equipment should be accessed if a hazardous chemical splashes directly onto a phlebotomist's arms and torso? Option A, A standard eye wash station. Option B. A safety drench shower. Option C. A fire blanket wrap. Option D. An isolation gown station. The correct answer is option B. A safety drench shower. A safety drench shower is used when hazardous chemicals splash over large body areas such as the arms and torso. Immediate flushing helps dilute and remove the chemical to reduce tissue damage. An eye wash station is designed for eye exposure rather than full body contamination. Question 15. Why should a phlebotomist avoid drawing blood from a paralyzed arm? Option A. The veins are too large and prone to exploding. Option B. The lack of muscle movement leads to poor circulation and potential thrombosis. Option C. The patient cannot feel if a nerve is being struck by the needle. Option D. Paralyzed limbs do not contain white blood cells. The correct answer is option B. The lack of muscle movement leads to poor circulation and potential thrombosis. A paralyzed arm may have reduced circulation, impaired sensation, and increased risk of thrombosis or swelling. Specimens from that limb may not reflect normal circulating blood as reliably. Lack of pain sensation can also delay recognition of injury, but poor circulation is the main concern. Question 16. Which of the following parameters can cause a false decrease in bilirubin levels if a sample is handled improperly? Option A. Over-isotonic chilling. Option B. Exposure to direct room light or sunlight. Option C. Inverting the tube more than 10 times. Option D. Delays in serum separation beyond 4 hours. The correct answer is option B. Exposure to direct room light or sunlight. Light exposure breaks down bilirubin and can produce falsely decreased results. Specimens for bilirubin testing should be protected from strong light soon after collection. Chilling, inversion count, or routine separation delays do not cause the same light-driven degradation. Question 17. What is the proper angle of insertion when using a winged infusion set, butterfly needle, to draw from a hand vein? Option A. 5 to 10 degrees. Option B. 10 to 15 degrees. Option C. 30 to 45 degrees. Option D. 60 to 90 degrees. The correct answer is option B. 10 to 15 degrees. A butterfly needle is inserted at a lower angle, often about 10 to 15 degrees, especially for superficial hand veins. The shallow angle helps enter small veins without puncturing through them. Steeper angles are more likely to cause infiltration or injury in hand veins. Question 18. What occurs when a phlebotomist shakes a blood collection tube vigorously instead of inverting it gently? Option A. Hemoconcentration of the plasma. Option B. Hemolysis of the red blood cells. Option C. Complete inhibition of clotting factors. Option D. Falsely elevated platelet counts. The correct answer is option B. Hemolysis of the red blood cells. Vigorous shaking mechanically damages red blood cells and can cause hemolysis. Additive tubes should be mixed by gentle inversions so the additive distributes without cell rupture. Shaking does not improve clotting control and can make the specimen unsuitable for testing. Question 19. Which of the following is considered an acceptable site for venipuncture if antecubital veins are unavailable? Option A. The dorsal aspect of the wrist. Option B. The dorsal aspect of the hand. Option C. The anterior aspect of the foot. Option D. The saphenous vein in the ankle. The correct answer is option B. The dorsal aspect of the hand. Dorsal hand veins are an acceptable alternate site when antecubital veins are unavailable. They are more superficial but may require a smaller needle and careful anchoring. Wrist, foot, and ankle sites carry greater risk and often require special approval. Question 20. What type of specimen is used for a guaiac smear test? Option A. Sputum. Option B. Urine. Option C. Feces. Option D. Cerebrospinal fluid. The correct answer is option C. Feces. A guaiac smear tests feces for occult blood. It is used to screen for hidden gastrointestinal bleeding that may not be visible. Sputum, urine, and cerebrospinal fluid are collected for different diagnostic purposes. Question 21. Which of the following additives is used in a blood culture bottle to neutralize antibiotics circulating in the patient's blood? Option A. Resin or activated charcoal particles. Option B, sodium polyant whole sulfonate, SPS. Option C, acid citrate dextrose, ACD. Option D, thixotropic gel barrier. The correct answer is option A, resin or activated charcoal particles. Resin or activated charcoal in blood culture bottles can bind or neutralize antibiotics present in the patient's blood. This improves recovery of organisms when the patient has already received antimicrobial therapy. The additive does not replace sterile collection technique or proper bottle filling. Question 22. Which of the following elements must be matched precisely between a patient's requisition sheet and their wristband? Option A, patient's first name, last name, and unique medical record number. Option B, patient's room number and name of their primary insurance carrier. Option C, name of the ordering physician and the date the patient was admitted. Option D, patient's diagnosis code and home phone number. The correct answer is option A, patient's first name, last name, and unique medical record number. The requisition and wristband must match the patient's name and unique medical record number or equivalent identifier. Matching these identifiers confirms that the order belongs to the patient being drawn. Insurance, diagnosis, and physician information do not establish patient identity at the bedside. Question 23. What is the primary purpose of the multisample needles rubber sleeve? Option A, to cushion the patient's vein from sudden movements. Option B, to prevent blood from leaking into the tube holder adapter between tube changes. Option C, to keep the needle sharp until it enters the vein. Option D, to guide the needle into the exact center of the vacuum tube. The correct answer is option B, to prevent blood from leaking into the tube holder adapter between tube changes. The rubber sleeve on a multisample needle seals the back end of the needle between tube changes. This prevents blood from leaking into the holder and reduces exposure risk. It does not guide the needle into the vein or protect the vein from movement. Question 24. Which analytical error is categorized as a pre-examination, pre-analytical error? Option A, miscalibrating a chemistry analyzer machine. Option B, misidentifying a patient before collecting their sample. Option C, misinterpreting a reading on a microscopic smear sheet. Option D, delays in transmitting finalized electronic reports to the doctor. The correct answer is option B, misidentifying a patient before collecting their sample. Misidentifying a patient before collection is a pre-examination error because it occurs before the specimen is analyzed. Pre-analytical errors often have the greatest impact on patient safety because the wrong sample can produce a believable but unsafe result. Analyzer calibration and report transmission belong to later phases. Question 25. Which of the following values represents a panic or critical laboratory value that must be reported immediately? Option A, a fasting glucose of 90 mg/dl. Option B, a potassium level of 2.1 mg/L. Option C, a total cholesterol level of 210 mg/dl. Option D, a white blood cell count of 7,500/mcl. The correct answer is option B, a potassium level of 2.1 mg/L. A potassium level of 2.1 mg/L is critically low and can cause dangerous cardiac rhythm disturbances. Critical values must be reported immediately according to facility policy. Normal glucose or white blood cell values do not require urgent panic notification. Question 26. A patient refuses to have their blood drawn. What is the most appropriate next step for the phlebotomist? Option A, convince the patient by explaining the doctor's orders. Option B, proceed with the draw while the nurse holds the patient's arm. Option C, document the refusal and immediately notify the nursing staff or provider. Option D, leave the room and mark the collection as completed. The correct answer is option C, document the refusal and immediately notify the nursing staff or provider. A competent patient has the right to refuse venipuncture, even when a provider ordered the test. The phlebotomist should document the refusal and notify nursing staff or the ordering provider so follow-up decisions can be made. Attempting to persuade aggressively or drawing against the patient's wishes can create legal and ethical problems. Question 27. Which of the following parameters is most heavily impacted if a phlebotomist squeezes or milks a finger during a capillary puncture? Option A. The sample will be contaminated with tissue fluids, leading to inaccurate results or hemolysis. Option B. The blood flow will stop completely due to arterial vasoconstriction. Option C. The platelet count will become falsely elevated beyond high limits. Option D. The glucose values will drop to zero within seconds. The correct answer is option A. The sample will be contaminated with tissue fluids, leading to inaccurate results or hemolysis. Milking a finger forces tissue fluid into the drop and can rupture cells. This dilutes the specimen and may cause hemolysis or inaccurate results. Gentle warming and proper puncture technique are preferred ways to improve blood flow. Question 28. When performing a newborn screening, PKU, collection card, how must the blood be applied to the filter paper? Option A. Layered drop upon drop until the circle is saturated. Option B. Applied to both sides of the paper simultaneously. Option C. Brought into direct contact with a single large drop to fill the circle completely. Option D. Smeared across the surface using a plastic capillary tube. The correct answer is option C. Brought into direct contact with a single large drop to fill the circle completely. Newborn screening filter paper should be filled by touching the paper to a large hanging drop of blood until the circle saturates. The blood should soak through evenly from one side without layering multiple drops. Smearing, scraping, or applying blood to both sides can invalidate the specimen. Question 29. What is the main reason for avoiding blind probing or sweeping when attempting to locate a vein? Option A. It breaks the vacuum seal of the multisample tube. Option B. It can cause permanent damage to underlying nerves and blood vessels. Option C. It dulls the needle tip and makes skin entry painful. Option D. It causes the patient's blood pressure to spike excessively. The correct answer is option B. It can cause permanent damage to underlying nerves and blood vessels. Blind probing or sweeping moves the needle through tissue without knowing where the tip is. This can damage nerves, arteries, tendons, and surrounding soft tissue. If blood flow is not obtained with minor adjustment, the attempt should be stopped and reassessed. Question 30. What type of fire extinguisher should be used on an electrical fire occurring in a laboratory centrifuge? Option A. Class A. Option B. Class B. Option C. Class C. Option D. Class D. The correct answer is option C. Class C. Class C extinguishers are used for energized electrical equipment. They are designed to suppress fire without conducting electricity back to the user. Water-based Class A extinguishers can be dangerous on electrical fires. Question 31. Which of the following options defines the proper site for an adult capillary puncture? Option A. The thumb or index finger of the dominant hand. Option B. The lateral or medial plantar surface of the heel. Option C. The palmar surface of the distal segment of the middle or ring finger. Option D. The side of the pinky finger near the cuticle. The correct answer is option C. The palmar surface of the distal segment of the middle or ring finger. Adult capillary puncture is performed on the palmar surface of the distal segment of the middle or ring finger. These sites provide good blood flow and avoid bone, tendons, and heavily used thumb or index finger surfaces. The pinky and areas near the nail bed are more prone to injury or poor flow. Question 32. Which of the following tests is used to evaluate the extrinsic pathway of the coagulation cascade? Option A. Activated partial thromboplastin time, APTT. Option B. Bleeding time test. Option C. Prothrombin time / international normalized ratio, patient / INR. Option D. Complete blood count, CBC. The correct answer is option C. Prothrombin time / international normalized ratio, patient / INR. Patient and INR evaluate the extrinsic and common coagulation pathways. They are commonly used to monitor warfarin therapy and assess clotting factor activity. APTT primarily evaluates the intrinsic pathway, and CBC measures cells rather than coagulation pathway function. Question 33. What does the term erythema mean? Option A, redness of the skin caused by congestion or inflammation of the capillaries. Option B, a pale appearance of the skin due to low red cell counts. Option C, a bluish tint to the skin caused by a lack of oxygen. Option D, a yellowing of the skin caused by high bilirubin levels. The correct answer is option A, redness of the skin caused by congestion or inflammation of the capillaries. Erythema means redness of the skin from capillary congestion or inflammation. It may be seen with irritation, infection, allergy, or localized trauma. Pallor, cyanosis, and jaundice describe pale, blue, and yellow color changes. Question 34. Why is a royal blue top tube used for trace element and toxicology testing? Option A, the tube contains a unique fast-acting liquid anticoagulant. Option B, the tube stoppers are specially manufactured to be free of trace element contamination. Option C, the tube is thicker to resist breaking in specialized centrifuges. Option D, the tube completely blocks out all infrared and UV rays. The correct answer is option B. The tube stoppers are specially manufactured to be free of trace element contamination. Royal blue tubes are manufactured to minimize trace element contamination from stoppers, glass, plastic, and additives. This is essential for toxicology and trace metal testing where very small contamination can alter results. The color does not mainly indicate light protection or faster anticoagulation. Question 35. What is the most appropriate step to ensure compliance with quality control measures regarding point-of-care testing, POCT, instruments? Option A, calibrating the machine once every year. Option B, running control solutions at scheduled intervals according to facility protocol. Option C, cleaning the display screen with water after every patient test. Option D, trusting the automated self-check system without external verification. The correct answer is option B, running control solutions at scheduled intervals according to facility protocol. Point-of-care testing requires routine quality control to confirm the instrument and reagents are performing properly. Running controls according to manufacturer and facility schedules helps detect problems before patient results are reported. Relying only on automated self-checks or annual calibration is not sufficient. Question 36. What type of consent is demonstrated when an adult outpatient rolls up their sleeve and extends their arm toward the phlebotomist after being asked for a blood draw? Option A, expressed consent. Option B, informed consent. Option C, implied consent. Option D, statutory consent. The correct answer is option C, implied consent. Rolling up a sleeve and extending the arm after being asked to provide a specimen demonstrates implied consent. The patient's actions show cooperation with a routine procedure. Signed informed consent is a more formal process used when required by policy or procedure risk. Question 37. What is the standard duration for an administrative scrub or hand washing when preparing for routine patient contact? Option A, 5 seconds. Option B, 20 seconds. Option C, 1 minute. Option D, 3 minutes. The correct answer is option B, 20 seconds. Routine hand washing before patient contact should last at least 20 seconds. This duration allows adequate friction and contact time to remove transient microorganisms. Very brief washing is ineffective, while surgical scrub times are reserved for different procedures. Question 38. Which of the following tubes should be collected last in the standard venipuncture order of draw? Option A, light blue top. Option B, lavender top. Option C, gray top. Option D, green top. The correct answer is option C, gray top. Gray tubes are drawn near the end of the standard venipuncture order because fluoride and oxalate additives can interfere with other tests. Earlier tubes such as cultures, citrate, serum, heparin, and EDTA have higher priority in the sequence. Drawing gray tubes too early increases additive carryover risk. Question 39. What is the liquid portion of an anticoagulated, centrifuged blood specimen called? Option A, serum. Option B, plasma. Option C, whole blood. Option D, fibrin clot. The correct answer is option B, plasma. Plasma is the liquid portion of anticoagulated blood after centrifugation. It contains clotting factors because clot formation has been prevented. Serum comes from clotted blood and lacks fibrinogen and many clotting factors. Question 40. Which of the following actions is a violation of proper sharp disposal safety guidelines? Option A. Dropping a needle into the sharps box immediately after withdrawal. Option B. Pushing down on items inside a full sharps container to make extra room. Option C. Disposing of a sharps box when it reaches the indicated full fill line. Option D. Placing the sharps container at eye level near the point of use. The correct answer is option B. Pushing down on items inside a full sharps container to make extra room. Pressing down on a full sharps container can cause puncture injury and aerosol exposure. Sharps containers should be replaced when they reach the marked fill line. They should be located near the point of use and never overfilled or manually compacted. Question 41. Which of the following tests requires a plain red top tube with no gel or additives? Option A. Complete blood count. CBC. Option B. Type and screen. Option C. Certain therapeutic drug levels that bind to gel barriers. Option D. Plasma glucose tracking. The correct answer is option C. Certain therapeutic drug levels that bind to gel barriers. Some therapeutic drugs can bind to separated gel or be affected by tube additives. A plain red top tube without gel is used when the test requires serum free from gel interference. CBC, blood bank testing, and plasma glucose monitoring use different specimen types. Question 42. For which of the following tests must a phlebotomist use a grey top tube containing potassium oxalate? Option A. Erythrocyte sedimentation rate, ESR. Option B. Oral glucose tolerance test, OGTT. Option C. Activated partial thromboplastin time, APTT. Option D. Blood urea nitrogen, BUN. The correct answer is option B. Oral glucose tolerance test, OGTT. Oral glucose tolerance testing uses grey tubes when glucose stability must be preserved over time. Sodium fluoride slows glycolysis, while potassium oxalate helps prevent clotting. Coagulation, chemistry, and hematology tubes do not provide the same glucose preservation. Question 43. How many times should a light blue top tube be inverted immediately after collection? Option F. 1 to 2 times. Option B. 3 to 4 times. Option C. 5 to 8 times. Option D. 10 to 12 times. The correct answer is option B. 3 to 4 times. Light blue citrate tubes should be gently inverted 3 to 4 times after filling. This distributes the anticoagulant without damaging cells or activating clotting. Too few inversions can allow clot formation, while vigorous shaking can cause hemolysis. Question 44. What is the proper location for a capillary puncture on an infant's foot? Option A. The center of the plantar surface near the arch. Option B. The medial or lateral borders of the plantar surface of the heel. Option C. The tip of the great toe. Option D. The posterior curvature of the heel bone. The correct answer is option B. The medial or lateral borders of the plantar surface of the heel. Infant heel punctures are performed on the medial or lateral borders of the plantar heel. These areas avoid the calcaneus and reduce the chance of bone injury. The arch, great toe, and posterior heel are unsafe sites for routine infant skin puncture. Question 45. A specimen for a lactic acid test must be handled using which special accommodation? Option A. Placed immediately on an ice slurry. Option B. Incubated at 37 degrees Celsius until tested. Option C. Kept away from all light sources using foil. Option D. Centrifuged immediately within 5 minutes of draw. The correct answer is option A. Placed immediately on an ice slurry. Lactic acid specimens are commonly chilled promptly to slow cellular metabolism after collection. Continued glycolysis can change lactate concentration if handling is delayed. Light protection or warming is used for different analytes, not routine lactate preservation. Question 46. Which tube is typically utilized to collect samples for blood bank cross-matching and typing? Option A. Pink top, EDTA, or plain red top. Option B. Light blue top, sodium citrate. Option C. Gray top, sodium fluoride. Option D, green top, sodium heparin. The correct answer is option A, pink top, EDTA, or plain red top. Blood bank typing and cross-matching commonly use EDTA pink top tubes or plain red top tubes depending on facility requirements. EDTA preserves red cell antigens and prevents clotting for many immunohematology procedures. Citrate, fluoride, and heparin tubes are used for other testing categories. Question 47. What tube additive prevents clotting by binding or chelating calcium? Option A, lithium heparin. Option B, EDTA. Option C, sodium polyethylene sulfonate. Option D, thrombin. The correct answer is option B, EDTA. EDTA prevents clotting by chelating calcium, a required cofactor in the coagulation cascade. This makes it especially useful for hematology testing where cells must remain unclotted. Heparin inhibits thrombin activity, SPS supports blood culture recovery, and thrombin promotes clotting rather than preventing it. Question 48. What type of urine specimen is ideal for routine screening and microscopic urinalysis? Option A 24-hour pooled collection. Option B, a random, first morning voided specimen. Option C, a multisample postprandial catch. Option D, a catheterized 12-hour collection sequence. The correct answer is option B, a random, first morning voided specimen. A first morning void is concentrated and useful for routine screening and microscopic urinalysis. It improves detection of cells, casts, proteins, and other substances that may be diluted later in the day. Timed collections and catheterized specimens are reserved for specific orders. Question 49. When performing a dermal puncture on an infant's heel, what is the maximum allowable depth to prevent osteomyelitis? Option F 1.0 mm. Option B 2.0 mm. Option C 3.0 mm. Option D 4.0 mm. The correct answer is option B, 2.0 mm. Newborn heel punctures must be shallow enough to avoid the calcaneus and deeper tissues. A maximum depth of 2.0 mm is used to reduce the risk of osteomyelitis and nerve or bone injury. Deeper lancets are unsafe for infants even if they appear to improve blood flow. Question 50. If a patient is receiving an intravenous 4 infusion in the right arm, where should the phlebotomist attempt to draw blood? Option A, directly from the foreline itself. Option B, from the left arm. Option C, above the foresight on the right arm. Option D, from the hand on the right arm. The correct answer is option B, from the left arm. Drawing from the opposite arm avoids dilution or contamination from the fore infusion. For fluids, medications, and additives can alter test results if sampled from the same side. Drawing directly from the line or above the infusion site requires special authorization and is not routine phlebotomy practice. Question 51. Which of the following items is the preferred antiseptic for cleaning a site prior to performing an arterial blood gas (ABG) draw? Option A, 70% isopropyl alcohol followed by chlorhexidine gluconate or povidone iodine. Option B, plain sterile water. Option C, diluted hydrogen peroxide solution. Option D, sodium hypochlorite spray. The correct answer is option A, 70% isopropyl alcohol followed by chlorhexidine gluconate or povidone iodine. Arterial puncture sites require strong antisepsis because the procedure is deeper and carries higher complication risk than routine venipuncture. Alcohol followed by chlorhexidine or povidone iodine is commonly used according to policy. Sterile water, peroxide, or bleach sprays are not appropriate skin antiseptics for ABG collection. Question 52. Which of the following conditions describes a vein that feels hard, cord-like, and lacks resiliency? Option A, patent vein. Option B, sclerosed vein. Option C, superficial vein. Option D, tortuous vein. The correct answer is option B, sclerosed vein. A sclerosed vein feels hard, cord-like, and poorly resilient because of scarring or repeated irritation. Such veins may not accept a needle well and can yield poor flow. A patent vein is open and resilient, while tortuous veins are winding rather than necessarily hardened. Question 53. Which of the following parameters must be strictly managed when collecting a sweat chloride test? Option A, keeping the sample frozen using dry ice. Option B, preventing evaporation of the sweat sample during collection. Option C, protecting the collecting flask from ambient artificial lights. Option D, drawing a matching light blue tube within 5 minutes. The correct answer is option B, preventing evaporation of the sweat sample during collection. Sweat chloride specimens must be protected from evaporation because chloride concentration can change as water is lost. Proper sealing and timely handling preserve the true concentration. Freezing, light protection, or paired coagulation tubes are not the main handling concern. Question 54. If a phlebotomist needs to collect blood from an infant via venipuncture, what is the preferred needle choice? Option A 21-gauge standard multisample needle. Option B, an 18-gauge hypodermic needle. Option C, a 23-gauge or 25-gauge winged infusion set, butterfly. Option D, a large bore trocar needle. The correct answer is option C, a 23-gauge or 25-gauge winged infusion set, butterfly. Infant venipuncture requires a small, controlled device to reduce vessel trauma. A 23 or 25 gauge winged infusion set allows better stability and visualization in small veins. Large bore needles increase injury risk and are not appropriate for fragile pediatric veins. Question 55. What is the maximum amount of time a tourniquet should remain tied on a patient's arm during a venipuncture? Option A, 30 seconds. Option B, 1 minute. Option C, 2 minutes. Option D, 3 minutes. The correct answer is option B, 1 minute. Tourniquet time should generally be limited to 1 minute to prevent venous stasis and hemoconcentration. Longer application can concentrate proteins, cells, potassium, calcium, and other analytes. Releasing and reapplying after a pause is safer than leaving it tied while searching for a vein. Question 56. What is the primary function of leukocytes? Option A, carrying oxygen to body tissues. Option B, preventing blood loss through clotting. Option C, defending the body against foreign pathogens. Option D, maintaining osmotic pressure in the plasma. The correct answer is option C, defending the body against foreign pathogens. Leukocytes are white blood cells that defend against infection and foreign material. They include several cell types involved in immune response, inflammation, and pathogen destruction. Red cells transport oxygen, platelets support clotting, and plasma proteins help maintain fluid balance. Question 57. What is the definition of fomite in an infection control context? Option A, an insect that transmits a virus. Option B, an inanimate object capable of harboring and transmitting infectious agents. Option C, a chemical agent used to sanitize skin surfaces. Option D, a specific type of airborne droplet nucleus. The correct answer is option B, an inanimate object capable of harboring and transmitting infectious agents. A fomite is a non-living object that can carry infectious material from one person or surface to another. Examples include bed rails, equipment, pens, and contaminated trays. Vectors are living carriers, while antiseptics and airborne particles describe different infection control concepts. Question 58. What type of vessel contains valves to prevent the backflow of blood as it travels back toward the heart? Option A, artery. Option B, capillary. Option C, vein. Option D, arteriole. The correct answer is option C, vein. Veins contain valves that help prevent backflow as blood returns to the heart at low pressure. These valves support venous return, especially from the limbs. Arteries carry blood under higher pressure and usually do not need valves along their length. Question 59. What is the primary clinical reason for avoiding the basilic vein whenever possible? Option A, it is too small to yield an adequate sample. Option B, it is located near the brachial artery and median nerve. Option C. It has a high tendency to collapse under low pressure. Option D. It contains valves that prevent blood flow into the tube. The correct answer is option B. It is located near the brachial artery and median nerve. The basilic vein lies close to the brachial artery and median nerve on the medial side of the arm. Accidental injury in this area can cause severe bleeding, nerve pain, or other complications. It is used only when safer veins are unavailable and the practitioner is confident in the site. Question 60. What represents the correct order for removing personal protective equipment, PPE, after a procedure? Option A. Gown, gloves, mask, goggles. Option B. Gloves, goggles, gown, mask. Option C. Mask, gown, goggles, gloves. Option D. Goggles, mask, gloves, gown. The correct answer is option B. Gloves, goggles, gown, mask. PPE is removed in a sequence that limits contamination of clean skin and clothing. Gloves are usually removed first because they are most contaminated, followed by eye protection, gown, and mask according to facility procedure. Removing the mask too early or touching the outside of contaminated PPE increases exposure risk. Question 61. When using a butterfly winged infusion set with a light blue top tube, why must a discard tube be drawn first? Option A. To clear any residual skin surface contaminants from the needle. Option B. To purge the air out of the butterfly tubing to ensure a proper fill volume. Option C. To activate the coagulation cascade prior to sample collection. Option D. To check if the vein has adequate pressure to fill a full tube. The correct answer is option B. To purge the air out of the butterfly tubing to ensure a proper fill volume. Butterfly tubing contains air that can reduce the fill volume of the first tube collected. A discard tube removes that air so a light blue citrate tube fills to the required level. The discard is not collected to clean the needle or activate clotting. Question 62. What should a phlebotomist do if they note a discrepancy between the patient's verbal name and the name on the pre-printed lab requisition? Option A. Change the requisition manually using a pen to match the verbal statement. Option B. Contact the supervisor or ordering nurse to resolve the issue before drawing blood. Option C. Draw the blood and sort out the labeling discrepancy later in the lab. Option D. Assume the patient knows their own name and print a new label on the spot. The correct answer is option B. Contact the supervisor or ordering nurse to resolve the issue before drawing blood. Any mismatch between the patient's statement and the requisition must be resolved before collection. Proceeding with unresolved identity information can create a wrong patient specimen and unsafe results. The phlebotomist should involve the supervisor, nurse, or ordering provider according to policy. Question 63. What does the term phlebotomy literally mean in Greek? Option A. To clear a blood clot. Option B. To measure blood cells. Option C. To cut into a vein. Option D. To study circulating fluids. The correct answer is option C. To cut into a vein. The word phlebotomy comes from roots meaning to cut into a vein. The term reflects the traditional act of opening a vein to obtain blood. Measuring cells, studying fluids, or removing clots describes different laboratory or clinical activities. Question 64. Which of the following blood components is responsible for the initiation of the coagulation process? Option A. Erythrocytes. Option B. leukocytes. Option C. Thrombocytes. Option D. Hemoglobin. The correct answer is option C. Thrombocytes. Thrombocytes, also called platelets, initiate primary hemostasis by adhering and aggregating at sites of vessel injury. They help form the initial platelet plug before the coagulation cascade stabilizes the clot. Red cells carry gases, and white cells primarily defend against infection. Question 65. A phlebotomist needs to collect a specimen for a complete blood count, CBC. Which color tube should be selected? Option A. Red. Option B. Green. Option C. Light blue. Option D. Lavender. The correct answer is option D. Lavender. CBC testing requires anticoagulated whole blood with preserved cellular morphology and accurate cell counts. Lavender tubes contain EDTA, which binds calcium and prevents clotting while maintaining blood cell detail. Serum, citrate, or heparin tubes can alter hematology results or create unsuitable specimens. Question 66. What is the standard depth of a lancet puncture used for a fingerstick on an adult patient? Option of 1.0 to 1.5 mm. Option B 1.8 to 2.4 mm. Option C 3.0 to 4.0 mm. Option D 4.5 to 5.0 mm. The correct answer is option B, 1.8 to 2.4 mm. Adult fingerstick lancets generally penetrate about 1.8 to 2.4 mm. This depth reaches the capillary bed while limiting injury to deeper structures. Shallower punctures may not provide adequate flow, and deeper punctures can cause unnecessary trauma. Question 67. What clinical condition is characterized by a high accumulation of bilirubin in the blood, causing a yellowing of the skin and sclera? Option A, cyanosis. Option B, jaundice, icterus. Option C, erythema. Option D, pallor. The correct answer is option B, jaundice, icterus. Jaundice, also called icterus, results from elevated bilirubin levels in blood and tissues. It causes yellow discoloration of the skin and sclera. Cyanosis, erythema, and pallor describe blue, red, and pale color changes from different causes. Question 68. Which vein is considered the first choice for venipuncture in the antecubital fossa? Option A, basilic vein. Option B, cephalic vein. Option C, median cubital vein. Option D, brachial vein. The correct answer is option C, median cubital vein. The median cubital vein is usually preferred because it is large, well anchored, and less likely to roll. It also lies farther from major nerves and arteries than the basilic vein. The cephalic vein can be used when necessary, but it is often less stable and more difficult to access. Question 69. Which of the following conditions is characterized by a dangerous drop in blood volume, causing pale skin, rapid pulse, and hyperventilation? Option A, hypovolemic shock. Option B, septic shock. Option C, anaphylactic shock. Option D, cardiogenic shock. The correct answer is option A, hypovolemic shock. Hypovolemic shock results from dangerously reduced circulating blood volume. Signs may include pale cool skin, rapid pulse, low blood pressure, anxiety, and hyperventilation. Septic, anaphylactic, and cardiogenic shock arise from different mechanisms. Question 70. Which of the following practices helps ensure compliance with standard precautions in phlebotomy? Option A, wearing gloves during all vascular access procedures and changing them between patients. Option B, reusing plastic tube holders as long as no blood is visible on the outside surface. Option C, washing disposable nitrile gloves with soap and water to extend their use. Option D, placing used lancets into regular trash cans if they look clean. The correct answer is option A, wearing gloves during all vascular access procedures and changing them between patients. Standard precautions require gloves for vascular access and glove changes between patients. This treats all blood and body fluids as potentially infectious regardless of known diagnosis. Reusing holders, washing disposable gloves, or discarding sharps in regular trash violates safe practice. Question 71. Which antiseptic is recommended for a patient undergoing a skin puncture for a blood culture if they are allergic to chlorhexidine? Option A, 70% ethyl alcohol. Option B, povidone. Option C, hydrogen peroxide. Option D, benzalkonium chloride. The correct answer is option B, povidone. Povidone is an appropriate alternative when chlorhexidine cannot be used for blood culture skin preparation. It provides broad antimicrobial activity when applied and allowed to dry according to protocol. Hydrogen peroxide and benzalkonium chloride are not standard substitutes for this purpose. Question 72. How should a phlebotomist approach a child who needs a blood test? Option A, tell them it will not hurt at all to gain their trust. Option B, explain the procedure in simple, age-appropriate terms and ask for their cooperation. Option C, have 3 guards hold them down before introducing yourself. Option D, show them the largest needle to prove how brave they need to be. The correct answer is option B. Explain the procedure in simple, age-appropriate terms and ask for their cooperation. Children cooperate best when the procedure is explained honestly in language they can understand. Asking for cooperation while using calm reassurance promotes trust and reduces fear. Saying it will not hurt or showing an intimidating needle can increase distress and loss of trust. Question 73. What is the correct protocol for mixing an additive tube after filling? Option A, shake it vigorously up and down 5 times. Option B, roll it back and forth between your palms for 30 seconds. Option C, invert it gently back and forth the recommended number of times. Option D, let it sit completely still in a rack to mix naturally. The correct answer is option C, invert it gently back and forth the recommended number of times. Additive tubes must be mixed by gentle inversion the number of times recommended for that tube. This ensures blood contacts the additive without causing mechanical cell damage. Shaking, rolling, or leaving the tube unmixed can lead to hemolysis or clot formation. Question 74. When centrifuging specimens, what is the most important operational rule to follow? Option A, centrifuging serum tubes immediately before they clot. Option B, ensuring the centrifuge load is balanced by placing equal volume tubes opposite each other. Option C, leaving the lid open slightly to prevent overheating of the tubes. Option D, setting the speed to the maximum RPM regardless of tube type. The correct answer is option B, ensuring the centrifuge load is balanced by placing equal volume tubes opposite each other. Centrifuge tubes must be balanced with similar volume tubes opposite each other. An unbalanced load can damage the centrifuge, break tubes, and create aerosol or biohazard exposure. Opening the lid during operation or using maximum speed without regard to specimen type is unsafe. Question 75. What type of specimen is generated when a blood sample collected in a plain red top tube is allowed to clot and then centrifuged? Option A, plasma. Option B, serum. Option C, whole blood. Option D, fibrinogen-rich extract. The correct answer is option B, serum. Serum is produced when blood is allowed to clot and the clotted specimen is centrifuged. It is the liquid portion remaining after fibrinogen and clotting factors are consumed in clot formation. Plasma requires an anticoagulant and still contains clotting factors. Question 76. What type of consent occurs when a patient is fully informed of the risks, benefits, and alternatives of a procedure and signs a document? Option A, informed consent. Option B, implied consent. Option C, verbal consent. Option D, statutory consent. The correct answer is option A, informed consent. Informed consent occurs when a patient understands the procedure, risks, benefits, and alternatives and documents agreement. It is more formal than routine implied cooperation. Verbal or implied consent may be enough for many routine draws, but signed informed consent is used when required by policy. Question 77. What is the standard ratio of blood to anticoagulant additive in a light blue coagulation tube? Option A 1:1, Option B 5:1, Option C 9:1, Option D 10:1. The correct answer is option C, 9:1. Light blue coagulation tubes require a 9:1 blood to sodium citrate ratio. This ratio preserves clotting factor measurement without over-anticoagulating the sample. Underfilling the tube changes the ratio and can falsely prolong clotting results. Question 78. What should a phlebotomist use to cleanse the skin surface prior to collecting a blood alcohol specimen for legal purposes? Option A, 70% isopropyl alcohol prep pads. Option B, povidone iodine or chlorhexidine gluconate or non-alcoholic soap and water. Option C, tincture of iodine solution. Option D, concentrated hydrogen peroxide spray. The correct answer is option B, povidone iodine or chlorhexidine gluconate or non-alcoholic soap and water. Blood alcohol specimens for legal testing should be collected using a non-alcohol skin cleanser such as povidone iodine, chlorhexidine, or soap and water. This avoids any appearance that alcohol from the prep contaminated the specimen. Routine isopropyl alcohol pads are avoided for forensic alcohol collections. Question 79. Which of the following statements is true regarding a multisample needle gauge? Option A 21 gauge needle has a larger opening than a 22 gauge needle. Option B. An 18 gauge needle is smaller than a 23 gauge needle. Option C. The larger the gauge number, the larger the needle lumen. Option D. All needles used in phlebotomy have the same internal diameter. The correct answer is option A. A 21 gauge needle has a larger opening than a 22 gauge needle. Needle gauge numbers work inversely: the higher the number, the smaller the lumen. A 21 gauge needle therefore has a larger opening than a 22 gauge needle. Assuming all phlebotomy needles are the same size can lead to poor device selection and hemolysis risk. Question 80. What is the function of the thixotropic gel inside an SST or PSD tube? Option A. To accelerate the coagulation cascade. Option B. To form a physical barrier between cells and serum/plasma during centrifugation. Option C. To preserve glucose levels for up to 24 hours. Option D. To chelate calcium and prevent fibrin formation. The correct answer is option B. To form a physical barrier between cells and serum/plasma during centrifugation. Thixotropic gel moves during centrifugation to create a stable barrier between the cells and the serum or plasma. This separation limits ongoing cellular metabolism and analyte exchange after spinning. The gel does not act as the anticoagulant or the clot activator. Question 81. What type of hazard does the blue quadrant of the NFPA 704 diamond represent? Option A. Flammability hazard. Option B. Reactivity hazard. Option C. Health hazard. Option D. Special or specific hazard. The correct answer is option C. Health hazard. The blue quadrant of the NFPA 704 diamond represents health hazard severity. It communicates the potential for harm from exposure to the material. Red indicates flammability, yellow indicates instability, and white is used for special hazards. Question 82. What is the function of sodium polyant whole sulfonate, SPS, inside a yellow top blood culture tube? Option A. To inhibit the growth of bacteria. Option B. To preserve glucose levels for bacterial metabolism. Option C. To aid in bacterial recovery by inhibiting complement and phagocytosis. Option D. To lyse red blood cells to release intracellular pathogens. The correct answer is option C. To aid in bacterial recovery by inhibiting complement and phagocytosis. SPS helps blood culture recovery by inhibiting complement, phagocytosis, and some antimicrobial activity in the specimen. This supports survival of microorganisms until incubation and analysis. It is not intended to kill bacteria or preserve glucose for chemistry testing. Question 83. Which of the following tubes contains a clot activator paired with a thixotropic gel barrier designed for serum separation? Option A. Light green top, PSD. Option B. Gold or red/black marbled top, SST. Option C. Lavender top, EDTA. Option D. Light blue top, sodium citrate. The correct answer is option B. Gold or red/black marbled top, SST. Gold or red-black marbled SST tubes contain a clot activator and thixotropic gel for serum separation. The clot activator speeds clot formation, and the gel forms a barrier after centrifugation. PSD tubes produce plasma because they contain heparin instead of a serum clotting system. Question 84. What type of glove material should be used if a patient or phlebotomist has a documented type I hypersensitivity allergic reaction? Option A. Powdered latex. Option B. Non-powdered latex. Option C. Nitrile or vinyl. Option D. Cotton utility gloves. The correct answer is option C. Nitrile or vinyl.
A subpoena dutes tecum orders a person to appear and bring specified documents, such as medical records. Residential ipsa loquitur is a negligence doctrine, meaning the event speaks for itself. Quid pro quo refers to an exchange-based form of harassment, and a deposition involves sworn testimony rather than the specific command to bring records. Question 85. A medical assistant is preparing to perform a capillary puncture on an adult patient. Which of the following fingers should the assistant select? Option A, index finger. Option B, thumb. Option C, ring finger. Option D, pinky finger.
The correct answer is option B, artery.
For adult capillary puncture, the distal segment of the middle or ring finger is preferred because it provides adequate blood flow with less risk of bone injury. The thumb, index finger, and pinky are avoided because they are more calloused, more sensitive, or have less tissue depth. Index finger is more sensitive and frequently used, so it is avoided for capillary puncture. Thumb tissue is often thicker and more calloused, making it a poor puncture choice, and the pinky has less tissue depth and greater risk of bone injury. Question 86. A medical assistant is reviewing a patient's billing account and notices a credit balance. What does a credit balance indicate? Option A. The patient owes the practice money. Option B. The insurance company denied the claim. Option C. The practice owes the patient or insurance company a refund because of an overpayment. Option D. The balance is zero. The correct answer is option C. The practice owes the patient or insurance company a refund because of an overpayment. A credit balance means payments or adjustments exceed the amount owed, so the practice may need to refund the patient or payer. It does not mean the patient owes more or that the account is zero. A patient debit balance means the patient owes money, a credit balance means too much was paid, a denial means the payer refused payment for a claim, it does not automatically indicate an overpayment refund is due, and a zero balance means nothing is owed by either party, unlike a credit balance. Question 87. Which of the following terms refers to the specific amount of money a patient must pay to keep their health insurance policy active? Option A, deductible. Option B, premium. Option C, co-insurance. Option D, allowed charge.
The correct answer is option C, allowing the patient to pump their fist repeatedly before and during the draw.
A premium is the amount paid to keep insurance coverage active. Deductibles, co-payments, and co-insurance are paid when services are used. A deductible is the amount the patient must pay before insurance begins paying for covered services. This insurance term describes a different part of patient financial responsibility or payer reimbursement than the one being asked about. An allowed charge is a different medical term, so its meaning does not fit the definition given in the STEM. Question 88. Which of the following organ systems is responsible for filtering waste products from the blood and maintaining fluid balance? Option A, digestive system. Option B, endocrine system. Option C, urinary system. Option D, lymphatic system.
The correct answer is option B. Remove the needle and tourniquet immediately, safeguard the patient from injury, and call for medical help.
The urinary system filters blood, removes wastes, regulates fluid balance, and helps maintain electrolyte and acid-base balance. Digestive and endocrine systems have different primary roles. That body system performs a different primary function than the one described in the STEM, and the endocrine system produces hormones that regulate metabolism, growth, reproduction, and many homeostatic functions. Question 89. A medical assistant is providing dietary teaching to a patient diagnosed with hypertension. Which of the following modifications should the assistant recommend? Option A, increase sodium intake. Option B, reduce sodium intake and follow the DASH diet. Option C, eliminate all carbohydrates. Option D, high protein, high fat diet. The correct answer is option B. Reduce sodium intake and follow the DASH diet. Hypertension teaching emphasizes reducing sodium and following the DASH eating pattern because both help lower blood pressure and cardiovascular risk. Increasing sodium raises blood pressure, while extreme carbohydrate elimination or high-fat dieting is not the standard hypertension recommendation. More sodium promotes fluid retention and can raise blood pressure, which works against hypertension management. Removing all carbohydrates is not a standard hypertension recommendation. Blood pressure teaching emphasizes sodium control, balanced nutrition, and heart-healthy eating patterns, and a high-fat diet does not align with DASH-style counseling and may increase cardiovascular risk in a patient already being treated for hypertension. Question 90. Which of the following types of codes are used to classify alphanumeric descriptions of procedures and services performed by providers? Option A ICD-10-CM. Option B CPT. Option C DSM-5. Option D E/M.
The correct answer is option B, submitting an underfilled light blue coagulation tube.
CPT codes describe medical, surgical, and diagnostic procedures and services performed by providers. ICD-10-CM codes describe diagnoses, and DSM-5 is used for mental health diagnostic classification. This code set is used for a different coding purpose, such as diagnoses, supplies, procedure details, or evaluation and management levels. Question 91. Which of the following conditions is an inflammation of the lining of the stomach and intestines, often caused by a virus or bacteria? Option A gastritis. Option B gastroenteritis. Option C colitis. Option D diverticulitis. The correct answer is option B, gastroenteritis. Gastroenteritis is inflammation of both the stomach and intestines and commonly causes nausea, vomiting, diarrhea, and cramping. Gastritis is limited to the stomach, while colitis affects the colon. Diverticulitis is inflammation or infection of diverticula, usually in the colon wall. Question 92. A medical assistant is collecting a sputum specimen from a patient. When is the best time for the patient to collect this specimen? Option A immediately before bedtime. Option B, first thing in the morning before eating or drinking. Option C, 2 hours after eating lunch. Option D, anytime throughout the day when coughing increases. The correct answer is option B, first thing in the morning before eating or drinking. Early morning sputum is preferred because secretions accumulate overnight and the patient has not yet diluted or contaminated the specimen with food or drink. Random daytime or bedtime collections are less likely to produce an optimal lower respiratory specimen. Bedtime collection is less useful for sputum because secretions accumulate overnight and are best collected after waking. Food and oral debris can contaminate the sample, making post-meal sputum less ideal, and random timing may produce a less concentrated or less diagnostic sample than the early morning specimen. Question 93. Which of the following precautions must a medical assistant take when handling a patient with active varicella, chickenpox? Option A contact precautions only. Option B droplet precautions only. Option C airborne and contact precautions. Option D standard precautions only. The correct answer is option C, airborne and contact precautions. Varicella requires airborne and contact precautions because it spreads through airborne particles and direct contact with lesions. Standard or droplet precautions alone are not enough. Varicella spreads by airborne particles as well as contact with lesions, so contact precautions alone are incomplete. This action does not address the highest priority safety or procedure requirement in the STEM, and standard precautions are used for all patients but are not enough for active varicella. Question 94. Which of the following terms describes the maximum amount of money an insurance plan will pay for a covered healthcare service in a given year? Option A lifetime maximum. Option B allowed amount. Option C out-of-pocket maximum. Option D capitation.
The correct answer is option B, a sharp, radiating, electric-like pain down the arm.
A lifetime or annual maximum is the cap an insurance plan will pay for covered benefits during the stated period. An allowed amount is the approved payment for a single service. Out-of-pocket maximums limit what the patient pays, and capitation is a payment arrangement with providers. Question 95. A patient presents with a blood pressure reading of 142/92 mmHg. Which of the following categories does this blood pressure level fall under? Option A, normal. Option B, elevated. Option C, stage 1 hypertension. Option D, stage 2 hypertension. The correct answer is option D, stage 2 hypertension. A blood pressure of 142/92 mmHg falls into stage 2 hypertension because the systolic value is at least 140 or the diastolic value is at least 90. Elevated and stage 1 categories are lower ranges. Normal blood pressure is below 120/80 mmHg, elevated blood pressure has systolic 120/129 with diastolic below 80. And stage 1 hypertension is lower than 140/90 under current adult categories. Question 96. A medical assistant is preparing to assist with a sterile surgical procedure. Which of the following is the correct order for performing a surgical hand scrub? Option A, wash hands, apply sterile gloves, rinse arms. Option B, clean under nails, scrub fingers, hands, and forearms up to the elbows with an antimicrobial agent, rinse keeping hands elevated. Option C, wash hands with bar soap, dry with a paper towel, apply alcohol gel. Option D, put on a sterile gown, then scrub hands with water. The correct answer is option B. Clean under nails, scrub fingers, hands, and forearms up to the elbows with an antimicrobial agent, rinse keeping hands elevated. A surgical hand scrub begins with cleaning under the nails and then scrubbing the fingers, hands, and forearms with an antimicrobial agent. The hands are kept elevated while rinsing so water flows from clean fingertips toward the elbows. Gowning and gloving occur only after the scrub is completed. Question 97. Which of the following values represents a normal adult pulse rate reference range? Option A, 40 to 50 beats per minute. Option B, 60 to 100 beats per minute. Option C, 110 to 130 beats per minute. Option D, 140 to 160 beats per minute. The correct answer is option B, 60 to 100 beats per minute. A normal resting adult pulse is typically 60 to 100 beats per minute. Rates below or above that range may indicate bradycardia or tachycardia depending on context. That rate range is outside the typical adult resting pulse range unless a special condition is present. Question 98. Which of the following terms describes the process of converting a medication from its original form into an inactivated state that can be eliminated by the body? Option A, absorption. Option B, distribution. Option C, metabolism. Option D, excretion.
The correct answer is option A, blood splashing into a phlebotomist's eyes.
Metabolism converts medications into inactive or more water-soluble forms for elimination, primarily in the liver. Absorption, distribution, and excretion are separate pharmacokinetic steps. Absorption is a different medical term, so its meaning does not fit the definition given in the STEM. Distribution is a different medical term, so its meaning does not fit the definition given in the STEM, and excretion is a different medical term, so its meaning does not fit the definition given in the STEM. Question 99. Which of the following microcollections tubes should a medical assistant draw first when performing a capillary puncture? Option A, lavender top, EDTA. Option B, green top, heparin. Option C, red top, serum. Option D, gray top, sodium fluoride. The correct answer is option A, lavender top, EDTA. For capillary collections, EDTA specimens are collected first to reduce platelet clumping and preserve hematology results. Serum and other additive tubes follow according to capillary order of draw. Green heparin tubes are not first in capillary order when EDTA is needed, serum tubes are collected later in capillary order, and gray fluoride tubes are generally collected after EDTA and other additive needs. Question 100. A medical assistant is performing a venipuncture. Which of the following tubes should be inverted 8 to 10 times immediately after collection to mix the additive? Option A plain red top tube. Option B lavender top tube. Option C light blue top tube. Option D glass serum separator tube. The correct answer is option B. Lavender top tube. Lavender EDTA tubes are inverted 8 to 10 times to mix anticoagulant and prevent clotting. Blue citrate tubes are typically inverted fewer times, and plain serum tubes do not contain anticoagulant. Plain red tubes do not contain the EDTA additive that requires repeated mixing for hematology specimens. Light blue tubes contain sodium citrate and are used for coagulation studies. They are not the tube for CBCs or many chemistry tests, and serum separator tubes are mixed fewer times and allowed to clot. Vigorous or excessive inversion can damage cells.